Around Cork City, political posters gaze down from the lampposts. But it's Ireland's healthcare crisis which the voters want the politicians to look at.
I know one incident of a woman that had to bring in pillows for her mother because they hadn't got pillows. So no, that's a joke as well, like.
If you have private insurance, it's fine, there's no problem. But for the ordinary man on the street, it's not good to see people waiting on trolleys for hours and hours.
Dr Sarah Fitzgibbon has worked in a deprived area of North Cork for the past 15 years. Her dedication is self-evident, and so are her frustrations.
So a child presenting today with mental health issues that I feel require specialist intervention, if I put them on a waiting list, they might be seen in 4 years' time, which is just, that's not a service.
In 2014, nearly 359,000 outpatients were on the public waiting list to see a consultant. By 2017, the number had risen above 500,000 for the first time. And in 2019, it had grown to more than 553,000.
To try to tackle those relentless increases in the waiting list, the Irish government is throwing millions every year of public money into buying private healthcare. In 2019, it was the equivalent of $82 million, and this year it's going to be closer to $110 million. And still the waiting lists go up.
Having private health insurance meant that when John Wall was diagnosed with terminal prostate cancer in 2017, prompt treatment helped extend his life. In the time he has left, he's advocating urgent reform.
Frontline staff do their absolute to do whatever they can, given the resources that they have. But that's the problem. They don't have enough resources. They don't have enough beds. They don't have enough staff. And the resources that are being allocated is basically throwing good money after bad.
A universal health proposal called Sláinte Care has been suggested, but the different political parties have very different ideas of what to prioritise and how to implement it.
So really what's important here is that the population that are going to vote on Saturday are really looking for change, and it's a change in culture to actually be citizen-centred and to put the politics aside to ensure that everybody can have safe, timely access to healthcare.
It was the threat of a no-confidence vote in Health Minister Simon Harris which forced the Irish Taoiseach Leo Varadkar to call this election, faced with a combination of public anger and the sense that no one was accepting responsibility. On Saturday, in the polling booths, the voters will hold the politicians to account. Paul Brennan, Al Jazeera, Limerick.